So in our current social environment, most of us do want a fairly presentable smile. One of the ways that can be achieved is by doing some whitening of the teeth. One of the questions I'm often asked is, does whitening damage the teeth? And that's a really good question. The short answer is yes and no. If it's done carefully, then any untoward effects to the teeth can be managed. But most whitening procedures will, in the short term at least, increase the roughness of the surface of the teeth. There are ways that you can talk to your dentist about to try to reduce that roughness and to offset any concerns. The other predictable risks of any sort of tooth whitening would be the possibility of tooth or gum sensitivity. Again, there are ways to minimise that as long as the person who's doing the whitening knows what they're doing. Obviously, there are different ways tooth whitening can be done. One would be in a professional setting, using a product and a system prescribed by a dentist. There are some other methods that are around that are either online or in shopping centres. Look, it's a difficult one to make a comment about all of them because I'm not there watching what they do, and often the chemistry of the materials they use is a bit secretive. I know I've asked one representative what it is that's being used, and she told me it was a salt, and it became evident that she wasn't really familiar, and that's nothing against her, it all came down to her training. She wasn't really familiar with what the material was. I don't know about everyone else, but I don't really relish the idea of putting some sort of unknown substance on my teeth or any other part of my body. So I would tend to approach those sorts of situations with caution. I'm not saying that some people don't get good results, but it's just a little bit risky, that's all, because number one, you're seeing someone who is there purely to address the cosmetics of your smile or the cosmetics of your tooth colour without really understanding your dental history or the situation of how healthy your teeth are or your gums are. So that would be my concern, is getting essentially a medical treatment done by someone who perhaps has very limited training in terms of how to manage the treatment itself and also how to reduce and manage possible complications.